is asthma? Asthma is a long-term disease of the lungs. You might hear your doctor call it a chronic respiratory disease. It causes your airways to get inflamed and narrow and makes breathing difficult. Coughing, wheezing, shortness of breath, and chest tightness are classic asthma symptoms. Severe asthma can make it hard to talk or be active. Some people refer to asthma as bronchial asthma. Asthma is a condition in which your airways narrow and swell and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. For some people, asthma is a minor nuisance. For others, it can be a major problem that interferes with daily activities and may lead to a life-threatening asthma attack. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and adjust treatment as needed. Symptoms. Asthma symptoms vary from person to person. You may have infrequent asthma attacks, have symptoms only at certain times, such as when exercising, or have symptoms all the time. Asthma signs and symptoms include shortness of breath, chest tightness or pain, trouble sleeping caused by shortness of breath, coughing or wheezing, a whistling or wheezing sound when exhaling. Wheezing is a common sign of asthma in children. Coughing or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. Signs that your asthma is probably worsening include asthma signs and symptoms that are more frequent and bothersome: increasing difficulty breathing, measurable with a peak flow meter, a device used to check how well your lungs are working, the need to use a quick relief inhaler more often. Causes. It isn't clear why some people get asthma and others don't, but it's probably due to a combination of environmental and genetic inherited factors. Exposure to various irritants and substances that trigger allergens can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne substances, such as pollen, dust mites, mold spores, pet dander or particles of cockroach waste; respiratory infections, such as the common cold; physical activity, exercise-induced asthma; cold air pollutants and irritants, such as smoke; certain medications, including beta blockers, aspirin, ibuprofen, Advil, Motrin IB, others, and naproxen, Aleve; strong emotions and stress; sulfites and preservatives added to some types of foods and beverages, including shrimp, dried fruit, processed potatoes, beer and wine; gastroesophageal reflux disease (GERD), a condition in which stomach acids back up into your throat. Risk factors. A number of factors are thought to increase your chances of developing asthma. These include having a blood relative, such as a parent or sibling, with asthma; having another allergic condition, such as atopic dermatitis or allergic rhinitis, hay fever; being overweight; being a smoker; exposure to secondhand smoke; exposure to exhaust fumes or other types of pollution; exposure to occupational triggers, such as chemicals used in farming, hairdressing and manufacturing. When to see a doctor. Severe asthma attacks can be life-threatening. Work with your doctor to determine what to do when your signs and symptoms worsen, and when you need emergency treatment. Signs of an asthma emergency include rapid worsening of shortness of breath or wheezing, no improvement even after using a quick relief inhaler, such as albuterol; shortness of breath when you are doing minimal physical activity.